Hello, my name is Angela Gartner, editor at Northeast Ohio Parent Magazine. Today we are with Dr. Evelyn Pangonis, and she is a pediatric infectious disease specialist and the medical director of infectious control and prevention at Akron Children's Hospital. Hi, doctor.
Hello.
And today we're going to talk about what's going on, how to keep your kids healthy. The first thing I want to talk to you about is what right now is the typical diseases and infections that you're seeing during this month.
Yeah. So I'd say within the past month on the outpatient setting, we're seeing all kinds of respiratory viruses, like a lot of the common cold viruses. The ones that have kind of made the headlines is the respiratory syncytial virus or RSV and influenza. But influenza seems to be the popular one as of the past couple of weeks. In the hospital, we're seeing a lot of flu. RSV, it looks like it's starting to decline a little bit, and then we're seeing a pretty steady amount of COVID as well.
And so as you guys are seeing this, have the numbers have been increasing in the flu? Like, why are we seeing such an increase, or why are we seeing the flu right now? And why are we seeing like these, especially like RSV? Why are we seeing these right now?
Yeah. So what happened when the pandemic first struck is that everything just kind of shut down. People stopped traveling. People started wearing masks in public. Schools closed, and that kind of put a hold on the RSV and the flu season for that year, with some of our other circulating viruses. And then once things laxed up, we started to see those infections come back again. So that's probably why at least these seasons are a little bit off cycle. Why those seasons are so severe right now, I think for the flu, it's probably because the predominant strain right now is a strain called the H3N2 strain, which can cause a lot of people to get the flu, even if you're vaccinated. If you're unvaccinated, we're seeing a lot of those kids and young adults in the hospital. Also, COVID, we know it has an effect on your immune system. So that may be why we're seeing older kids with RSV, where typically we would see kids in the hospital that are younger than 2.
So, like, what are the typical symptoms that you're seeing across the board, whether it's, COVID, RSV, or the flu?
Yeah. So sometimes those infections can overlap in their symptoms. So commonly the flu presents with high fevers, muscle aches, chills, just kind of an overall feeling of unwellness. Sometimes cough and sore throat. RSV can just cause congestion, runny nose, cough. In little kids, we worry about when they have either fast or heavy breathing, meaning they're using extra muscles to breathe. And COVID can cause no symptoms, can cause the flu symptoms, can cause regular cold symptoms. Yeah, it's kind of it's a great mimicker.
What are the typical ages? Is it happening across, is more younger kids getting certain things and more older kids getting other things?
So historically, with RSV, most kids that are in the hospital with with RSV, we call bronchiolitis or infection of the lower airways, have been kids less than 2, just because of the overall shape and size of their lower airways. We've been seeing kids younger than 5 this past year. With flu, we see kids of all age. Usually, they've had the flu and then they come back the following week with a bacterial pneumonia. And COVID, we've seen healthy kids in the hospital with COVID. More often, we see kids that have other health conditions like asthma, like cerebral palsy, or heart conditions, or things like that.
What are your concerns about this year?
I think the overall, like how many kids we're seeing in the hospital and on the outpatient setting, it can be daunting to parents and also providers. Like, can I get my kid to see the doctor? If I go to the ER, am I going to be waiting for 12 hours? Do they have enough beds? Do they have enough staff? Now, luckily, we've been able to accommodate the patients that we've seen here, but I know, as we've seen in the pandemic, we don't want to get to that point where we're bursting at the seams.
Yeah, so let's talk about that. Let's talk about fevers, because that's a pretty typical symptom for at least the flu, right? Um,
Yes.
and so tell me a little bit how parents can treat fevers at home, and then also talk about when they should be concerned and take them to somewhere like the ER or call their doctor.
Mhm. Yeah. So I consider a fever anything that's over 100.4 Fahrenheit, and it can be taken various places. So under 3 months of age, usually the best way to take it is rectally. Over 4 years of age, you can take it orally, and between that, you can take it in a various ways, either the forehead, the temple, the ear, under the armpit. Um, what I know some parents will, or some parents and even providers will look at how high the fever is and try to determine what the cause of the fever is. For me, it matters more on if they have a fever and what the child looks like when they're having a fever, and then also when you bring the temperature down, what do they look like? Are they happy, back to being happy and playful? Those kids I'm not as concerned about. So mainly for fevers, we're treating the child being uncomfortable. So you can use we use Tylenol at any age. I don't usually recommend parents give Tylenol to kids younger than 2 months of age, because in those kids, I'm worried about a bacteria, or them being evaluated for a bacterial infection. And parents at home can give ibuprofen or Motrin to kids older than 6 months of age. And then kind of warning signs to look for when they should call the doctor. So if the child is younger than 2 years of age, if they've had a fever for more than 24 hours, if they're older than that, if they've had a fever for more than 3 days, if they're if there's any signs of dehydration, meaning they're crying, they're not making tears, their lips are not nice and moist. If they have any signs that could indicate a bacterial infection like ear pain, a sore throat, um, or if the parents have any concerns, they can always call their doctor. Now, when should they go to the ER? So parents should go to the ER for if they have an infant that's younger than 2 months of age with a fever, if the child is not making urine within 8 hours, if they're breathing either too heavy, meaning using their extra muscles to breathe, if they're breathing fast, um, or if they're like sleeping and not waking up, or they're having any other issues like seizures or confusion.
As far as fevers go, so you said, you consider 100, over 100, anything a fever. How high can a fever get before a parent should start to worry?
Yeah. So, like I said, anywhere between 100.4 or anything over 100.4, I consider a fever. For me, the how high the fever is, up to say if it's 103, 104, 105, I think if you bring the temperature down and the kid is back to being kind of happy and playful, those are less concerning. Where if the temperature's normal and the kid still looks like he doesn't feel well and is not uh, as talkative as normal, he doesn't really want to do a whole lot of things. uh, if it's over 100 points, 106, 100, 107, that would be concerning. Usually your brain is able to regulate how high your temperature gets, as long as you don't have any other issues with your brain, like if you have uh, damage to the part of your brain that regulates your temperature, or in patients that have heat stroke, or patients that are in the intensive care unit. We want to monitor their temperature really closely.
So it's really about how their activity is,
Yeah.
and to kind of monitor whether they're toddlers to school age to teenagers, making sure that,
Mhm.
how are they feeling, and their activity level, right?
Yeah. And saying why we get so concerned about babies less than 2 months, especially babies under 1 month, is because there are barriers that separate their blood from their brain to their kidneys, isn't as mature as we get older. So if they have an infection in their urine, it can spread to their bloodstream and to the lining around the brain. Now, as the kids get older, you can still have those things, but they're just much less common.
So, I mean, we're kind of getting into the season where a lot of, people are getting sick. So, I mean, what would you recommend that parents kind of have on hand, whether it's in their medicine cabinets or, just or even in their kitchen?
Yeah. So my three favorite things to keep at home are Tylenol or acetaminophen, ibuprofen, or also under the name Motrin, and then nasal saline. And then if you have babies under a year of age, then those little rubber bulb suction things. I know everybody, especially adults, love to use the cough and the cold medicines. Now, we don't really recommend those under 6 years of age. And kids under 4 years of age, they've actually been found that it can have some pretty dangerous side effects like excessive sleepiness, seizures, and even abnormal heart rhythms. And even in kids between 6 to 12 years of age, they haven't really been shown to be that beneficial. Actually, one of the best medicines for a cough is something that I would think that my grandmother would have told me. It's honey, and we would recommend that for cough for anybody that's older than a year.
Yeah, and that's just what I wanted to ask. So, you know, I think, obviously the most common symptoms are, stuffy nose and cough across these kind of things that are happening this year. So is there any recommendations for, for kids who are, younger, but then also for the older teens?
Mhm. Yeah, so for a stuffy nose or runny nose, obviously having tissues at home for the older kids that are able to blow their nose. The nasal saline with or without the bulb suctioning can also help kind of keep it, make sure everything is all the mucus is nice and loose. Having a humidifier and keeping it near the child. Those are kind of the main things that we use um, for stuffy noses.
So you kind of touch on this, but just to ask this question, as a parent, sometimes it's hard to know when it's appropriate to call the doctor. So, what are some signs and symptoms that you should call the doctor? And then what is really when you should just take them to, urgent care or the ER?
Mhm. Yeah. So I try to split it into, I guess, you know, mild and non-mild. Although obviously being an infection specialist, my definition may be a little bit biased, but I think for when to call your doctor, I'd say if your child is having cold, like just regular cold symptoms, and they're not going away after about a week or 2 weeks, most respiratory viruses their symptoms should go away within a week, but some may linger on into the second week. But if they're lasting any longer than that, they should call their doctor. So if you brought their fever down and they're still kind of acting sick, meaning uh, they're not kind of their happy playful self, and they're still just kind of laying around and not wanting to do it, or if the parents are concerned about the child, they should call the doctor. um, so if they have fever that persists for more than 12 hours in kids that are younger than two, or sorry, if they have any fevers that persist more than 24 hours in kids younger than two, or in kids older than that, if fevers persist for longer than 3 days. um,
So are you seeing any other illnesses like strep or any other things kind of happening as well?
Strep throat is pretty common, especially during the winter season too. So that's pretty common. I know in other countries they're seeing a lot of like strep infections in other areas of the body, like the bloodstream or other. So we do see that on occasion. Luckily, we're not seeing the amounts that they're seeing like in the UK. Other, in the hospital we see a lot of different types of infections, bone infections, joint infections. Um, but luckily, I don't think these are more happening more commonly than we do see during the rest of the times of year or in other areas of the country.
Well, how can we keep our kids healthy and our whole family healthy, especially as the upcoming especially as the holiday
Mhm.
season is coming up?
So I think the best things to do to keep people safe and healthy are staying home when you're sick, trying to avoid people that are sick. I know sometimes that may be easier said than done. Um, good hand hygiene goes a long way on kids that are able to do that, or parents can be helpful with uh, helping the kids to wash their hands after they've touched surfaces, or if they've coughed into their hands, to make sure they're not spreading germs. And then to make sure that everybody gets the flu shot. Anybody that's older than 6 months should get their flu shot. Like I said, we've seen a lot of kids in the hospital um, over the past month, and you can still get the flu even if you've had the flu shot, but you're much less likely to get sick and hospitalized with the flu.
And I know we're with the ramp up in flu now, for those who've already had the flu, what are your recommendations if they should if they should still receive the flu shot?
Yeah, so I still recommend flu shot to my patients who've had the flu, because it covers for, I think it's three different strains, and during different times of the year, or as we get into late winter and early spring, there may be other flu viruses circulating, so you can get the flu more than once, unfortunately.
Why is it important to get the flu shot?
My biggest rationale for recommending the flu shot is it keeps kids and adults healthy. Um, Sorry.
No, it's okay.
Only one more time. So the reason I recommend the flu shot is because people that are vaccinated against the flu are much less likely to get hospitalized or even die from the flu.
Is there any, like, a lot of parents, take vitamins, and then also kids, they recommend their kids to take vitamins as well. Do you have any recommendations? Not speaking of the brand wise, but do you have any recommendations for vitamins that we can take around these time of years for kids?
Mhm. So, well, in general, I believe it's recommended that breastfed infants take vitamin D supplementation. Other than that, as long as the child's eating a well balanced diet, they shouldn't be deficient in any vitamins.
If you want more information, please visit us at northeastohioparent.com.